Facebook, it is about, I guess, about 6:45, a little bit after that. I'm actually coming to you this morning live, second floor, Willis Knight in Piermont. 6 weeks ago, I walked down this hall into surgery to have a total hip replacement. It changed my life. I just am so excited about taking away the pain, the things that I can now do that I didn't think I was going to be able to do again. This is what was put inside me. This is the, I guess, the stem and the ball. This guy's, well, let me tell you what, this guy knows a lot more about this than I do. This is Dr. Cambize, Shahrdar. He is the
Good morning.
The guru of hip replacements. He's done over 2,000 of them. Thank God you're right here in Shreveport. We love that.
It's a pleasure.
Show the folks at home exactly what you did with me.
When we did your surgery, we made an incision in the front of the hip. It's usually about 10 centimeters in length, and we are able to go between the different muscle bundles.
And that is a key thing, folks. There is no muscle cut, no tendons, ligaments cut. The advantage of that is
that after the surgery, there's no hip precautions to follow.
Okay. When he says precautions, there's no things that you can't do.
That's right.
Like with other procedures, you can't cross your legs.
That's right.
For 6 weeks.
That's right.
You can't bend over.
That's right.
You can't sit in a low chair.
Avoid low chairs.
Okay.
Don't cross your legs over.
Don't cross your legs. What we're talking about here is 2 ways to do it. The posterior approach, which is more traditional. That's from behind. There you're cutting through butt, okay, the gluteus and the rotary muscles. The way that he does it, and really the way he has pioneered in the last 15 years, is from the front. They call it anterior. No muscle cut, and thus the pain and the recovery time is greatly reduced, right?
That's correct.
I hate to put words in his mouth, but I've studied this a lot because I was super excited to have it done. One of the things that convinced me to do it, folks, is that he showed me some videos of patients of yours walking down a hall just like that at 2 weeks, and they were walking almost totally normally. And I said, are you kidding me? That can be me in 2 weeks? And he said, yes. And that's the advantage of doing it the way that you do it.
That's correct, yes.
Okay.
And it helps the patient's recovery.
Yeah, let's talk about that. Can we compare and contrast anterior and posterior in terms of recovery?
Yes, yes. If you have a posterior approach for the first 6 weeks, they're going to tell you things that you have to avoid.
Right.
So you're being restricted with things like, for example, if you're going to sit on a chair, you got to sit on a high chair.
Okay.
At home, if you have low chairs, you got to put cushions or something if you want to sit on them.
Right.
And then you can't lean forward to touch your toes. They're going to give you a little grasper.
Right.
If you got to pick things up, all these special tools you need.
Wow.
With the anterior approach, you go home. Immediately afterwards, you can reach forward to touch your toes, put your socks on. You can lay in any position that you want. There's no restrictions.
Right. Now, we will say this. Long term, the good results are the same.
That's correct.
A year out, posterior, anterior, the results are the same.
That's correct.
So the real advantage happens in the first few weeks.
In the first 3 months is where the studies show that the patients with the anterior approach excel.
Okay. All right. Fantastic. Again, I'm just sharing this with you because it changed my life, and I know I'm not alone. A lot of folks, because I think I was headed to a wheelchair eventually. I had severe arthritis. And that's the other point I want to make here, folks. My pain was in my leg, and it had gone on for months and months and months. My hip felt fine. I had no idea there was a problem with my hip until he did the x-ray. And he said, man, you got great knees. I got 20-year-old knees, tell him that.
That's right.
But my hip was like 90-year-old man. So that's what I didn't realize. So if you have problems, have pain, see a guy like this, see somebody who knows what they're doing. X-rays can reveal a lot.
That's right.
Right.
That's right.
And then it's not nearly as bad as you think. In terms of joint replacements, knees, shoulders, and hips, probably the fastest recovery and the least pain is the hip.
Yes, I would agree with you.
Okay. And age is also not a factor either. You've had, one of your patients was how old?
100.
100 years old?
Yes.
The average patient is early 60s,
Yeah,
right?
that's correct, yeah.
Okay, fantastic. Again, he's done over 2,000 of these. When it comes to the anterior approach to this procedure, there's nobody around who's done as many as he has. But the key is find a good surgeon.
That's right.
And however you do it, the long-term results are pretty much the same.
That's right.
The hip is one of those joints that you can really replace, and it can change your life in so many wonderful ways. Love the guy. I really do. It's some neat guys. Again, it's a neat guy. By the way, his name is Dr. Cambize. Got a great name. Shahrdar. If you want more information, call his wonderful nurse, Holly, in his office at Willis Knight.